Hello, I'm Tim Sandle and welcome to my 9th video about coronavirus. And last week we looked at the R number and why it matters. And you can find this along with the other videos in the series on my YouTube channel. So this video we build, if you excuse the pun, on some things we discussed in the 7th video, which is looking at the protective measures required to bring down the spread of the coronavirus in the as-built environment. And this kind of leads on to something that's quite topical, and it's about the calls being made by a number of governments around the world to reopen shops, including the UK-led Johnson Conservative administration. And my view is that this is potentially coming too early. There are important considerations to weigh up, because after direct transmission from coughing and sneezing, where there is the deposition of large respiratory droplets that tend to fall close to where they've been expired, which is why the 2 meters matters, and also from touching contaminated surfaces and then touching your face, eyes, nose, mouth, then transmission via droplets in the air, although there's still considerable research being done around this, presents the most probable third route of infection. So how do we know this? Well, there's been at least 4 published studies where air sampling has been undertaken, and the air sampling activities as practiced in hospitals, for example, have recovered several positive samples of the SARS-CoV-2 genome, that is RNA, and that's been demonstrated through the application of polymerase chain reaction or PCR testing. So with that in mind, what measures should be taken to minimise airborne transmission in the as-built environment? Well, we need to consider things like effective engineering controls in order to give us effective ventilation, particle filtration, and also with air disinfection. So with ventilation controls, this is about how quickly air is removed from a room and replaced with fresh air over a set period of time. And in terms of improving the indoor space, the placement of air supply and exhaust vents ensures that adequate air dilution is achieved, and hence it helps with minimising the build-up of viral contamination in a given space. And we assess this through air changes per hour, and we're seeking at least 20 air changes per hour. Now, while most hospital spaces and also clean rooms will have adequate air ventilation, it stands that most shops, offices and schools will not have purpose-built mechanical ventilation. So instead they're reliant upon open doors and open windows to achieve the necessary air changes, which is going to be relatively minimal. However, even where mechanical ventilation is in place, this is often not operated optimally. And this is because the owners wish to minimise energy usage and hence reduce costs. So in either scenario, there remains the possibility that infected persons sharing the airspace with susceptible occupants do pose an infection risk, and this could well contribute further to the spread of this infectious disease. And this, of course, rests on how infectious viral particles are over a period of time. And this is around at least 1 hour. So there's an interesting paper by Van Dorleman, and this paper is titled Aerosol and Surface Stability of SARS-CoV-2 as compared to SARS-CoV-1. And it's been published within the last month in the New England Journal of Medicine. Other measures, of course, are avoiding air circulation and minimising the number of people in an airspace. So with the recirculation of air, this is often put in place to save energy. However, this process can transport airborne contaminants round and round, including infectious viruses. And although particulate filters and the use of air disinfection can help to minimise this, these are not always in place. Sometimes the filters are not large enough, and so they need to be purposely designed and regularly maintained. But the best strategy is not to recirculate air, but to rely 100% on the use of outdoor air. Now, in terms of air disinfection, there are some studies that indicate that germicidal ultraviolet light can be effective, and this includes UVC. And also raising the humidity, as we discussed in previous videos, can also help. Now, with germicidal lights, these can be placed in rooms, especially where air stagnation is more likely. But placing units directly into air ducts is going to be far more effective. So for a good overview of some of these measures I've discussed, then there is a paper called How Can Airborne Transmission of COVID-19 Indoors Be Minimised? And this is by Morikawa and colleagues from the University of Colorado, and it's been published in a journal called Environmental International. Now, of course, we still need to consider building controls in conjunction with other established controls such as isolation, physical distancing, and of course regular hand sanitisation, again as we've covered in previous videos. But the risks around these measures, and given the level of infected people potentially in the general population, is why opening shops too early, in my opinion, presents too great a risk. Now, just briefly changing track, in terms of the self-isolation element, this is also why we need to support measures like the track and trace systems being implemented by most governments, either by apps or through manual checking processes. So with the manual checking processes, this is where people are employed as contract tracers, and the objective is to track down people and telling them to be self-isolated if the evidence is they've potentially been exposed to an infected person. So the focus here is whether someone's been in contact with an infected person for 15 minutes or longer at a distance of less than 2 meters, or whether someone's been in direct contact, say, with another member of their household at distances of less than 1 meter. And here either apps automatically report, or people employed as contract tracers will contact those people potentially at risk and ask them to self-isolate for 14 days. So this is even though the people themselves may not be showing any symptoms or feel that they have COVID-19, that self-isolation act is really important. So in this video, we've looked at the importance of good air ventilation. We've looked at the importance of not recirculating air and looking at air disinfection measures. But the general advice at the moment is avoid crowded spaces and keep that 2 meters physical distancing in place. So that's it for this video. I'm Tim Sandle. So to receive future updates and information about new videos, then please subscribe to my YouTube channel by clicking the link below. So thanks again, and please stay safe.